If I could do any job, that'd have to be a mascot at Old Trafford. Sorry, start again. My name is Aamer. I'm Principal Pharmacist in Education and Development at Guy's St Thomas's. Today we are in the dispensary at Guy's Hospital. This is the engine room of the pharmacy. So we have lots of staff in here, ranging from assistants through to pharmacy technicians through to pharmacists who are supplying medicines for our patients. So lots of people think that as a pharmacist all you do is supply medicines. Actually there's a load more that we do, there's a load more thinking that we do before we can even give medicines to our patients. This is who you are, this is your medical history, these are the conditions that you have, these are the medicines that you've been prescribed, these could be your allergies, this could be the dose that you need, is it the right drug in the first place? We do all of that before we give it to the patient, and once we've given it to the patient, it's about making sure the patient understands what they're going to do with that tablet, that inhaler or that cream. So imagine if you had asthma and you didn't know how to use your inhaler properly, and you had an asthma attack and you didn't know how to use your inhaler, you're not going to get that benefit of that treatment, therefore it could make things worse. I was working in a community pharmacy when I was a 17-year-old. I was always interested in science, and when I was doing my GCSEs and A-levels I was very good at science and I liked the science subjects, and the pharmacist that I worked with at the time recommended pharmacy as a career. So I looked into that as a career option and looked at universities that I wanted to go to and then applied to university to do pharmacy. I ended up doing my training here at Guy's St Thomas's and I've stayed here ever since. We have lots and lots of training and support in this hospital, and we train our staff from the entry point when they come in as pharmacy support staff. We can then develop them into either a pharmacy technician or a pharmacist, and when they are training to be a pharmacist they get a 1 year worth of training with me, looking after them to make sure that they've got the skills that they need to be a pharmacist. You need to be patient, you need to have diplomacy, you need to be tactful, you need to have resilience because it's a challenging work environment, and you need to have really thick skin sometimes because you have to make decisions that people don't like. But the most important thing is to have an understanding of what that role involves before you go for it. Do some research, look into it, find out what the career is about. Then the next thing would be to get some work experience in that area. So go into a community pharmacy, go into a hospital, just to spend a few days, see what goes on and see if you like it, if that's something that you'd be interested in. And then start thinking about your A-levels, and if you're already doing your A-levels, start thinking about which university you want to go to. And then after that, start thinking about where you want your career to go. Is it in a hospital? Is it in a community pharmacy? Where is it? And then start making contact with those people and developing a career in that way. The coolest thing I did was a couple of weeks back when I was asked to take part in a TV advert. So I did some shooting a bit like this, but I had to follow a script. I thought that was really cool because I've never done something like that before. And it's really cool because it's on YouTube and it's going to go on national TV.